This is a one-arm floor press with a mini band. So I got a fairly light mini band to start at my wrists here, kind of just above where a watch would be. I'm gonna get one dumbbell, come down, feet are flat on the floor, little brace across the core just so you're stable. You can support your head if you need to. I'm gonna start at the top. I'm gonna make a fist in my hand without the weight, and I'm gonna pull apart, trying to point the crease of my elbow up towards my ear. So this part of the elbow up towards my ear. And then from there, I'm gonna slowly come down, squeezing my shoulder blades down into the floor and away from my ears, and pressing up. Coming down, pressing up. All right, so I'm gonna break down some of the technique things here, but this is the motion. So what do we got going on here? Well, first, often with a lot of shoulder pain and pressing, there's an internal rotation moment that's uncontrolled and can place altered or more load on different parts of the shoulder. And so some of the rotator cuff muscles externally rotate, and we're trying to get those a little more active through our pressing motion. And so the band here, as my arm is bent, it's trying to pull my wrist this way, which is internal rotation. And so I have to resist that as I come through the motion. A lot of kind of lower level physical therapy exercises are external rotation drills. They can help with a variety of different things going on the shoulder. And so now we're trying to take that isolated motion, that isolated activation of the rotator cuff muscles, and bring it into our press. So that's what the band is doing. And just one weight, I find, forces a little more stability, which is often what we're going for with a drill like this. Second, shoulder blade position. So as I'm here and I'm pressing on the floor, obviously, I want to press into this position where my shoulder blades are down, proud chest. So you're almost pulling your shoulders to your pockets and into the floor. So we have a nice proud chest. This is a stronger position. Then often folks come down and their elbow again comes up here, or they're pressing in this pattern. And so how I like to look at it is, if I was gonna push somebody away from me, I would wanna start here and press. And most people do if I ask them to mimic that motion. So something you could try at home, close your eyes and imagine you're pushing something away from you as hard as you can, and then pause in that bent arm position. Most people are gonna come somewhere right around here. They're not gonna come up here. But often in a push-up or in painful pressing motions, I see that the bottom position looks more similar to this, which is internal rotation and a shrug up of the shoulder, often not our strongest position. So with the band on, pressing down, squeezing down and back, and then pressing up. So show a couple more reps here. Just want a light engagement so my low back is flat. And then often I'm using this as we're reintroducing pressing. And so I want to go slow at the start, nice and slow and controlled. And then I'm on the floor because that limits my range. Often people will come pretty far behind them, and again, they're in the same position. So the floor is kind of a safeguard, so I don't go too far into a position that I can't yet control. We'll work on the depth. And if it's painful to go all the way down, then just pause an inch or two here, feel stability in this pause position, and then press up. So we do not have to go to full range, even on the floor, especially when we're starting out. So that's the one-arm floor press with a mini band. One of my favorites as we're reintroducing pressing after having done it for a while, or maybe there's some shoulder discomfort in pressing. If you do have shoulder pain, of course, check with your healthcare provider. But otherwise, give this one a shot. I don't like to work through pain, so we should find a level we're moving slow, maybe a lighter weight, feeling those band stabilization positions where this can feel like quite a bit of work through the upper body, the mid back as we draw back, through the tricep, back of the shoulder, into the chest a little bit. So we get a lot out of this one, but we want to set it up so we're moving in and out of these key positions.